Or the scratches. Good evening, ladies and gentlemen, and welcome to the special Valentine's Day edition of Battling and Beating Cancer on CAN TV 21 in Chicago. We are streaming live worldwide at cantv.org/live and chicagobloodcancer.org. I'm Charlene McMann, and the other half of me here is Scott Seaman.
The smaller, crummier, sort of shorter half.
And we are the co-founders of Chicago Blood Cancer Foundation, a nonprofit committed to curing lymphoma, leukemia, and myeloma. We are going to be doing some great things tonight. Sometimes other challenges come up, like a diagnosis of cancer, and you need someone by your side to help you. And as Scott will tell you, I was by his side, and that's why he's here today. But to advocate for you and to be your reason for living, our prior shows this season illustrate that selecting the best doctor and best treatment for you are key to surviving cancer. But the reality is navigating through all the treatments, options, paperwork, and challenges for a cancer patient can be overwhelming. Another reality is that your surgeon, oncologist, radiologist are not the only members of your healthcare team. Nurses and nurse practitioners actually develop most of your care, spend most of the time with patients and their families, and are critical. So tonight, Scott will be speaking with Jean Ridgewood. Jean is a fabulous lady. She's a nurse practitioner in the Hematology Oncology section at University of Chicago. They will talk about navigating from diagnosis to cure, coping with chemotherapy, cancer survivorship, and resources available to patients. A tremendous resource, of course, is our Battling and Beating Cancer, the Cancer Survival book, and we will give copies to the first 3 people that call in at 888-792-9992 and leave a message with your name and full mailing address. And
wow, that's a heck of a Valentine's Day present for somebody, isn't it?
It is, yes, and we'll even sign it for you if you like. But and I'm going to turn this over to my other half here, Scott.
All right, before you dash away, though, you are my Valentine. And, of course, those of us who have gone through cancer, having a loved one by your side is really the key to survival, because number one, they look out for you, like Charlene was saying. They check things, they double check things, they get the information, they look over your care, but also because they're the reason that we live. You have to have a reason to live.
Yes.
And who can think of a more beautiful reason? Happy Valentine's Day, honey. There you go, kiss on TV.
And he's only doing this because we're on TV. He doesn't do this at home. He won't even talk to me. So, but anyway, yeah, I'm a checker, and I think one of the big things for a patient and caregiver is checking, check. That's my motto. So I'm going to turn it over to you, Scotty.
Thank you, Charlene. Well, I have to tell you that if you want to reach us, if you have any issues with lymphoma, leukemia, myeloma, which are the blood cancers, reach out to us at chicagobloodcancer.org or call us at 888-792-9992. That's the same number you can call for your free book, which is the deal of the century. Or you can like our Chicago Blood Cancer Foundation Facebook page. You can look at prior episodes of this show, or if you want to see this show again, because Gina's going to tell you some things that you're going to want to remember and maybe look back at and see again. So you can do all that by either going to chicagobloodcancer.org or by going to our Chicago Blood Cancer Foundation YouTube page. And Jean, first of all, thank you so much for joining us tonight on Battling and Beating Cancer. And you know that Jean has a magnificent heart because she's here with her husband sitting in the studio, and they're delaying their Valentine's Day dinner so that they could give you some important information about cancer. And Jean, so thank you not only for coming on today, but for all that you do day in and day out to help so many people, because when you hear the words you've got cancer, boy, it hits you like a ton of bricks, doesn't it?
Mm-hmm.
And so as Charlene said, you need to go to the right doctors, and we've had so many of them on this show, but day in and day out, it's the nurses, it's the nurse practitioners that really are there for you, a major asset. They spend more time caring for you than the doctors, and they also have more time to give you the information, tell you what you need. So what I'd like to do, Jean, is to start out by having you sort of tell us, a new patient comes in and you see him or her for the first time. What do you sort of tell them about what's in store for them as a cancer patient and what they need to do to get through it?
Well, I work at an academic university, and so when patients come to us, they have the diagnosis of a presumed cancer or a lymphoma. And so on our first meeting, it's usually the patient and their family. And actually, one of the things that I like to do when I meet people is to ask them a little bit about themselves. So, what do you do? What do you like? What's your job like? Because it gives the caregivers a better idea of how to structure what we're going to tell them. It gives us an idea of what they've left behind and what they're going to return to. So we really like to find out more about the person, because there's so much more to having a diagnosis of cancer than having the cancer identify and just describe you. So we start out with that. And, oftentimes we will say to the person, what do you know about your diagnosis? What have you heard? And let's start with that. Because like you said, oftentimes when people get the diagnosis of a cancer, then everything shuts down. They know they have a cancer, but they have no idea what it's called. They can't really remember the specifics of it. And that's where a family member or good friends come in, because you're going to need somebody there with you. There's really no way to take in all the information, especially at a new patient appointment, that is going to be given to you. So when we see brand new patients, we usually spend at least an hour with them. It's a very long appointment because there's so much to talk about and to interact with. Many times we will ask patients to bring as many records as they can with them. And so that puts a lot of responsibility on the family. They, perhaps had a biopsy because of a hospitalization or some blood test. So they'll bring those records with them, or sometimes they get sent via email. So those kind of things need to be brought with. And then we start at the beginning, and we'll say that, according to this information that we've been given so far, we know that you have a certain type of lymphoma. And then we stop and allow people to interact and engage with and process. What did you hear? Tell me what are your next questions? What do you want to hear about?
So there's not really a standard list. There's some sort of standard items and subject matter you want to cover, but it's not a one-size-fits-all, because all the patients are different. And I like what you said at first, was you get to know something about the patient, because not only once they get that diagnosis, they don't just wear that label of cancer patient. They still are whoever they are. And I think one of the things that's good is for a patient, to the extent they're able to, and obviously your priorities change, and you have to, your schedule is subject to the mandates of the doctors and the treatments, but to the extent that you can stay in your regular life and do the things you did before and the things that you like to do, and maybe just go a little bit easy on yourself and accommodate your schedule, but you want to keep living.
Absolutely. And, for example, one type of lymphoma that we see is Hodgkin's lymphoma, or Hodgkin's disease. And the standard treatment for Hodgkin's disease is getting chemotherapy one time every other week, but for 16 to 20 weeks. And so oftentimes for people who are working, it's good to come on Friday so that you can have your chemotherapy on a Friday. So it's only one day off a week, and then you have the weekend to really recover if you're going to have some problems with nausea or anorexia, and then to, have that long weekend and then go back to work on Monday.
The other thing I wanted to pick up on that you had said earlier is the importance of records. And a lot of times patients will come and they'll have a few records, but they won't have everything. Or they may have the reports from a CAT scan or the pathology report if it was done in another institution, if they're going for a second opinion. And you really want to find out before the appointment what information, what records, and it takes time to get them so that your first appointment can be more productive.
Exactly. If you've been diagnosed with some type of cancer, a leukemia, myeloma, or lymphoma, and you're making an appointment to see a specialist, you do want to get those records. You own that information. It's your material. You're legally entitled to get that material. One thing that might be tough is, actual tissue slides from pathology at times can be a challenge, getting it from institution number 1 to institution number 2, but there is a process. And I would recommend, if I needed to get my records, I would call the medical record department and say, I'm a patient, I had these tests done, I'm seeing for a second opinion this doctor, and ask what their process is. Some hospitals will take the initiative and fax everything over. Some will actually give you the packet of information, and then you'll hand deliver it upon your appointment. I would say ask the subspecialist, what do you want me to bring with, so that I have a complete folder with me when I arrive.
And people on both sides will help you. The institution where the records are and the institution that you're going to will help facilitate that. There are some hoops you have to go through in terms of signing release forms, and sometimes you have to charge them with lightning to get the thing done and get it done in a timely manner. But you want to have those records, and the pathology, particularly for the blood cancers and lymphoma, that's so critical to the diagnosis, as Dr. Gregory had told us last week. And so when you get a second opinion, you don't just want the report, you want that pathology, so that you're getting a meaningful second opinion from the hemopoietic pathologist who's a specialist in figuring out the types of blood cancer. And in fact, Charlene and I met with one this afternoon, and a very important field, particularly for lymphoma, because it's the pathology that makes the diagnosis. And it's Valentine's Day, so Charlene is smiling at me when normally she's frowning at me, Jane. So that must be good. Now, one of the things I wanted to go into are side effects, because for me, I had surgery, radiation, and chemo was in the middle, and I was scared and frightened to death of all of them. But the chemo really scared me the most, because you know you're going to get sick, or you fear you're going to get sick. And then I hear stories from people that it was like a moonwalk for them. It was no big deal. So it really does vary depending on the person and their general health and the types of chemos, because the regimens are different. But what I'd like to do is just sort of go through some of the common side effects, because there are so many things that patients and your healthcare team can do. There's remedies for some of the side effects. There's things you can do to avoid or minimize some of them. So what are some of the more common side effects from chemo?
A big side effect, and probably one that from a medical point of view is not that problematic, but it's very problematic to people, is the loss of your hair. And so that happens, like you said, with some drugs, but not with others. And so I would say don't use that as an excuse of not to get chemo. Sometimes people say, if I'm going to lose my hair, I'm not going to get chemotherapy. It will grow back. Sometimes it's curly, sometimes a different color, but wherever you have hair growth, you have hair loss. So for guys, it's a bonus, no shaving. For women, it's just bonus, no shaving on the legs. But that's a common concern.
Yeah. And look, it's important, especially, an ugly guy like me, I felt bad because I looked even uglier. But for young people and young women, I mean, they spend a lot of time and attention, making themselves look beautiful. And you sometimes you look sicker than you are with the chemo because of these effects, but they are just short term. You need to you need to sometimes take that kind of a punishment, so that you can live.
Right.
But nausea, upset stomach, that's a common symptom. So what do you do about that?
So nausea, a lot of times people are worried about nausea and vomiting. A number of new agents have been developed over the past 10 to 15 years. And so we've got vomiting kind of down pat. People sometimes have vomiting, but it's usually nausea. So the nice thing is, before you get your treatment, what I try to do, I saw a young woman earlier this week who started brand new today with her lymphoma treatment. And when she left our appointment on Monday, we had already called in all of her prescriptions. So she had them at home. It wasn't like somebody had to stop and pick them up. So getting them ahead of time, I think, is really important. You will get anti-nausea medicine at your clinic visit, and then you'll be given a couple options, different families of medications to use.
Forget about the compazine. There is Zofran.
There is Zofran, or
and other things.
and other things.
They didn't have that back in my day, but that's even better for a lot of patients.
It really works really well. It's the drug specifically designed for chemotherapy-induced nausea and vomiting.
And it's important to focus on your blood counts, which get checked regularly. There's a certain point in time they go up and down based on the chemo. And, one thing patients always want to know is if they should take vitamins or do super duper things. And the answer is you don't want to do that without telling your doctor.
Right. When you're going through treatment, on the days you're having active treatment, and for 24 to 48 hours, no vitamins, no supplements, no homeopathic, none of that. Because actually some of those things can interfere with the drugs we're trying to give you to cure your cancer. And they can affect the metabolism of other drugs as well. So none of that on the days of treatment and a couple days beyond. But you alluded to the blood counts, and the single most important thing I tell patients when they leave after the first chemotherapy is, if you don't remember anything else, is that you must call us if you develop a fever 100.5 or greater. You pick up the telephone. Day or night, weekend, holiday, it doesn't matter. You have to call someone because it can become a life-threatening emergency. It's very, very important. So you need a thermometer at home. Lots of options, but get one and learn how to use it. You know, your doctor's going to need to say, what's your temperature? So when you call and say, oh, I feel crummy, I'm hot, I'm sweating, they're going to say, what's your temperature? So get one. And give a call.
Yeah, and this notion of, well, if you don't feel good or something comes up, call the emergency room. As a patient, don't settle for that. Your oncologist, your oncology team should give you a number, an email, some ways to directly contact a member of your team.
Exactly.
It's very important, and you shouldn't have to go through the system or be seen in the emergency room. You should be able to have a contact immediate.
You really do need that. And one of the things I like to do is, we provide a card, like our business cards, yes, but then we also have a yellow card, and I say, this is your brand new refrigerator magnet. Put it on the refrigerator, because if you feel ill, you don't remember, and if your family member has to go through your wallet or your purse, it's just not very effective. So put it up there where everybody can see, and make sure you understand the directions.
And plus, if your wife goes through your wallet, she may take some money out of there, so you don't want that to happen. But the other thing, and Charlene was excellent about this, which is, and it irritated me a little bit, but at the time, but thank God for it, which is she was like, Sergeant, no infection. And so when I came home, she wiped me down. She made sure that I was away from people, not in crowds, not on planes.
So there are certain things you can do to minimize your risk of getting an infection. The first thing, and probably the most effective thing, is hand washing. Soap and water is great. If you don't have access to soap and water, then you can use a waterless hand gel, but wash your hands. Especially, viruses can live on tables, they can live on grocery carts. So if you touch them and then you touch your nose, you're going to go ahead and give yourself a gift that you won't want. So those should be avoided. You can wear cloth gloves if you do go to the grocery store. And you need to tell your friends, we'd love to see you, but you can't come over with a sniffle. And if you have friends with children, that's a big
Stay
issue.
away from children.
You need to stay away from
They
children.
always get sick.
You need to stay away from crowds, for just the short term when you're going through your treatment, because we want you to stay healthy. You stay on track with your treatment being given every 2, 3, 4 weeks. If you get sick, and sometimes that happens, things get delayed. And if we can avoid that, we try to avoid that. There used to be a thinking that you had to restrict your diet pretty severely, and that's been disproven. So the only thing now, when your counts are very, very low and your white counts are low and those neutrophils are very, very low, the only thing that is suggested is that no raw fish and no raw berries or broccoli. And it has everything to do with eating food that potentially could be contaminated, you ingesting it, and then the bacteria leaving your gastrointestinal tract and becoming an infection in your blood.
And good habits, which you should actually keep at, when you're not on chemo, in terms of avoiding people who are sick, washing your hands regularly, avoiding touching your face, avoiding foods that are either not cooked, and make sure you wash off vegetables and those sorts of things. Now then, and the other thing is, for the low counts, whether you're red, you're white, your blue counts, your platelets are low, there are shots now that you can get, and there's different alternatives, which are a huge advancement over the last several years. So you just need to stay on top of that. Another major symptom that people feel, I still feel it to this day, is fatigue and being tired and weakness. What do you do to help with that?
So the tiredness and the fatigue that comes along with treatment, it changes as you go through your course of treatment. So with a long-term survivor, chronic fatigue can be a problem. A general rule of thumb is to stay as active as you can. So if you're a walker, walk. Don't walk in the mall, but you can walk on the treadmill, you can walk outside. And you need to maintain yourself. So, you need to get up in the morning, say, because you're going through therapy, you found that you've needed to take time off of work, you still need to maintain a daily schedule that's going to give you a sense of quality of life. So get up and get dressed and get dressed in something other than jammies. And be active, and that takes a lot of different forms.
Which is too bad because now they have those pajamas that are like jeans and stuff. So there's a lot of good stuff out there. The other thing that continues to plague me, and by the way, there are a few advantages of having cancer. Then you have some built-in excuses. But one that a lot of people experienced, and until recent times wasn't always heeded even by doctors, is chemo brain.
Mm-hmm.
Can you talk about that a little bit?
So people throw the term chemo brain around. As they enter into therapy, it hasn't been a scientifically proven entity, but any patient you talk to who has a cancer diagnosis and is undergoing therapy will say, oh, I kind of have this chemo brain, my memory's not so good.
Feel a little foggy sometimes you can't focus.
Right. And we don't know why that is. I would imagine it has something to do with neurotransmitters and the effects of it. Some of it is stress, and I say to people when they do that, what are your deficits? Is it short-term memory? I can't remember where I put my keys, or I'm having trouble reading. So identifying what your deficit is going to help you to create a solution. For some people who have to take medicine all the time, I'll say to them, well, how do you remember anything? For our younger patients, it's all about the iPhone, or it's all about the phone. So there's programs now that they're medication reminders. You put them on your phone. You put them for your reminder for appointments, for blood counts, but you can remember it that way. If it's reading and comprehension, if you're in the middle of therapy, I would say give yourself a break. You have an incredible amount of pressure. Just let's see what happens after all the treatment is over. And if you truly want to explore it further, there's neurological and neuropsych testing that can be done to really quantify what the problem is.
But most times, I think the key is it's transitory.
It is.
That once your treatment stops in a few weeks or sometimes a couple months pass,
right,
you find that some of that dissipates.
Absolutely.
Now, in my case, it continues, which is why I have these big notes all the time. But
that's age.
Well, that's also age too. So, in terms of patients now have access to a lot of information through the internet and reliable sources such as Chicago Blood Cancer Foundation. But what can you tell patients in terms of doing their research and their homework, but then using the information in a constructive way, not diagnosing yourself with every disease under the sun?
That's a hard. In some ways, it's a simple solution, but in other ways it's very difficult because you want to get information, certainly, but you want to go to a reputable source or sources. I would say, going to, like the Leukemia and the Lymphoma Society, that's a reputable source. Going to the National Cancer Institute, they have information. But what you need to stay away from is Susie's blog, unless you know Susie. But, people are out there just kind of saying all kind of things, and I would also be cautious about all these alternative, potential alternative therapies. I think you should always feel free to get a second opinion and talk that information over with your physician.
Well, and that's the key. Sort of, it's good so you've got some good questions to ask your physician or your nurse practitioner, so that you can, or your physician's assistant, whatever, whoever you're dealing with, to get information, to compare things, to ask them, well, how about this treatment, or wouldn't this work, and find out from them, if it applies to you or it doesn't, because you are the captain of your healthcare ship, and you have to direct it. And along those lines, what can you just tell us generally? Some advice to help patients just make it through.
Make it through. I would say remember that this is a short-term blip on the radar screen. This isn't everything. This disease doesn't define you. You should empower yourself to take control over the disease, and try to be positive. There's a lot of people like yourself,
like who was negative, but I had Charlene with me who was
positive. There's some organizations who will mentor you up with a person. If you're a 45-year-old woman, you've just gotten diagnosed with Hodgkin's disease.
You can call our buddy Johnny Emmerman at Emmerman's Angels. And
there are a lot of groups out there. Part of it is getting networked in with these groups. So going to one reputable source oftentimes can help you lead into these other ones.
One or two final questions. We're going to go into a little bit of overtime, but we've scanxiety. You know, we live and die by the test. Our next CAT scan, our blood test. What do you tell patients about dealing with test results?
It's hard. I mean, you get anxious about going for the test. You're anxious during the test, and everything hinges on the result of that test. And remember that, you know, tests do give us information, and the scans do give us pictures. The way you feel also helps identify it. And you know, if you're feeling great, you know, if you can remember the time like before your diagnosis, a lot of people really didn't feel well. They're having a medical crisis. If you're back to work and you're halfway through therapy and you're like, wow, I'm not short of breath, I feel pretty good, I'm a little tired, but you know, not so bad. Be confident. And you know, the information that you get from your practitioner about the curability and the treatment successes, you should be confident with that. Also. And
you should be nice to your nurse.
Well,
because
of course.
And Jean, thank you so much.
You're very
Fabulous
welcome.
source of information. And you know what's wonderful is that there's some bad nurses out there, and there's some mediocre nurses, just as there are doctors. And when you have one on your team, fire them. And why make sure you get somebody like Jean, somebody who cares about you, somebody who will take the time to give you the information that you need, who will watch over you, who will make sure you get the medicines that you need, that you get that extra. I mean, we all need a little love and attention to make it through, and through your support system and family, or through your nurses and your healthcare team.
Because we're here to help you. I mean, and we want to hear from you. Don't think that, you know, we want to hear from you. So please contact us. However, your healthcare providers, whatever their system is, ours is paging, you know, ours is face-to-face, then do that and talk to us and tell us, even if you think it doesn't really matter, if you're not sleeping well, if your feet are bothering you, let us know, because maybe there's something we can really, really help you with.
Well, again, thank you so much, Jean.
You're welcome.
And ladies and gentlemen, happy Valentine's Day to you, to Dorothy, our wonderful executive producer, Christy, our CAN TV staff, from your Cupid. We'll see you next week here on Battling and Beating Cancer. Good night, everybody.
Good night.